Are anticonvulsant medications called for, always called for, never called for? Are they a treatment of symptoms? Are they palliative? Are they curative? These are all very valid questions. Now, there are some seizures where medication is called for. A first-time seizure may require medication until one knows what caused the seizure, what in the brain triggered the seizure activity. So in that instance, medication may be called for. It is not always called for. If a seizure is a first-time seizure, it's a short-lasting, and it's a young child who just had a febrile episode, then it may be considered a febrile seizure, in which case, once the fever is under control, there are no more seizures, and those instances do not require medication. Is it possible that any anticonvulsant medication can cause seizure or seizures? Yes, it is. There has been demonstration in the literature that Dilantin, which for a long time was a very popular anticonvulsant medication or antiepileptic medication, and still is used quite frequently, can, after about a week of treatment, trigger seizures. There are also a large number of antiepileptic drugs or seizure medications that have come about in the last 10 years, and this has given neurologists around the country the opportunity to treat patients with different drugs if an initial drug has not worked. It used to be that when one medication did not work to control the seizures, a second medication was added, and if it still didn't work, then a third medication. And some patients would wind up on 2, 3, 4 medications. Well, these medications work by inhibiting brain activity. The more you inhibit the brain activity, the more you're putting the patient at risk of having another seizure because you're causing further injury to the brain. If one considers that a seizure is an abnormal electrical discharge from part of the brain that's out of synchrony with the rest of the brain, then maybe one can prevent the seizure from happening by suppressing the electrical activity of those brain cells that are being abnormally activated somehow. And many of the drugs are developed to inhibit the electrical discharge from those abnormal brain cells or those abnormally active brain cells. So it's through inhibition. Well, if you're inhibiting the abnormal brain cells, you're also inhibiting some of the normal brain cells. And in that sense, seizure medication is not always useful, so the side effects of the seizure medication are sometimes more harmful than the actual seizure itself. So yes, seizure medications do help some people. They help by inhibiting that abnormal part of the brain, but there's a price to pay, and that's inhibition of other parts of the brain, which can dull brain activity, they can dull memory, they can dull cognitive functions, they can dull attention span. So that's another reason why seizure medications, if they can be avoided, should not be given. What can a parent do if they don't want to give their child medication or are afraid of the side effects of the medications? Because certainly medications can have side effects, especially antiepileptic medications. Their side effects consist of slowing down brain activity, dulling the brain, interfering with cognitive function, interfering with memory, and a lot of these side effects are very unpleasant. So the first thing a parent should do when a patient has a seizure, or has seizures in the plural, is to try and figure out what triggers the seizure. We know that a seizure is a manifestation of an abnormality in the brain. There's a part of the brain that's discharging electrical activity out of synchrony with the rest of the brain. But very often, if that abnormality of the brain is there, the seizure is triggered by an outside factor. There are many, many, many factors that can trigger a seizure. Temperature changes can trigger a seizure. Different types of foods can trigger a seizure. Allergies can trigger seizures. Flickering lights, loud noises. The multiplicity of triggers is pages long. And it behooves the parents first to try and figure out what the trigger might be. If they haven't figured out the trigger, then they need to figure out ways to improve brain maturity, because that abnormal part of the brain is not mature considering the rest of the brain. So programs to enhance brain maturity then become the course of action.